Good morning.
Good afternoon.
Hello, welcome back, Dr. Francis.
Thank you. Thank you. Did you have your tea break? Is it time for tea break or we continue? Chit?
Yeah, we already took a break. After the session, there will be a lunch break.
Okay. So we continue, and then you break for lunch. Am I right?
Yes, correct.
Okay. So good morning, all of you. How are you feeling this afternoon? Good. Good.
Wonderful.
Okay. How many curriculum did we finish? Now, can anyone tell us? Hello? Hello?
We've almost finished course 5.
Course 5. You are right, Alka.
Almost finished.
Yeah. Course 5 you finished actually. We are starting with course 6, that is case management. And today we will just skip through the case management, and then tomorrow we start 7th curriculum. Tomorrow maybe half an hour continue with myself. After that, Dr. will. How do we start? We start with case management. Okay. Before I start case management, have you ever heard this concept, case management? Do you have a case manager at your facilities? I would request all of you to please be active, because you have been listening a long time. Now let us be a little bit active. Have you ever heard about case management? Or do you have a case manager in your facilities? Hello? Hello, my dear friends, my Thai friends and Myanmar friends.
Hello.
Yeah. Have you ever heard what is case management? Because this course is all about case management. We will be discussing what is case management, types of case management, functions of case management, etc. in this particular course in the coming 2-3 hours. So I would like you to speak rather than I speak. Come on. If you know anything about case management, please speak.
To me, the case management is something like a case treatment are focused on the medication and taking care of the patient, but the case management see the patient as a whole and not only the treatment or other administrative arrangement, like you need to contact some other department. We can provide some services for the patient or client.
Yes, Tim, you are absolutely right. Let's clap. Come on. All of you, please clap. Please clap. Yes, very good. I want you to virtually clap rather than giving symbols. Okay. So, as Tim said, case management is like you are providing or coordinating from a single point of contact all the necessary needs of the client. It's not only the counseling services or medical services like medical, counseling, mental, legal, employment, food, clothing. All these services are coordinated by a single point of contact. That person who coordinate all these services is called the case manager. So it's like, it's a it's not just a counseling. Case manager, of course, can provide counseling, but he is more than that. He is a person who contacts everybody who are concerned of providing various needs of the client, various service providers, bring them together and help the client meet his needs. He contacts the doctor, he contacts the HIV counseling center, he contacts the legal advisor, he contacts the food supplying agencies, he also contacts the housing agents. Likewise, he contacts them, coordinates the services, and makes sure that the clients he can get access to all these services, or he can avail. So he is the person, the case manager is the person who coordinates all these services. He functions, he works with others, and all these agencies work together. When they work together, the client finds it easy, affordable to meet his needs. That's the importance of case management and the case manager. Now let me know, do you have case managers in your country, in your facilities? Do you have such a system where you appoint case manager in your facilities? Can somebody speak? Let me ask the Thai friends. I see you are busy with your mobile. Thai friends, could you tell me whether you have case manager in your facilities, treatment centers? Unmute and speak.
เปิดแล้วค่ะเปิดแล้วค่ะ
Okay.
For case manager, usually we have in NTD, NCD clinic, but for drug addicts rehabilitation, usually we have one-stop service.
Oh, so it's nice for us, for all of you, to think about case manager in your facility, because case manager can function effectively and he can help the client meet his needs. We know that a client who is using alcohol or drugs may have various needs. He comes to our facility or treatment centers Yes, needs proper
ถ้าคุณ
education,
fragmented service ใช่ป่ะหรือว่าอะไร
job training,
แค่บางส่วน
legal aid. Legal
ว่า
aid,
แต่ว่าอย่างเช่น
legal aid comes when you have some issues with the legal system. They might have been involved in some criminal cases or any petty cases. Cases may be pending against them, and therefore they require legal aid. They may not be having economical support to avail legal aid, legal services. So here is the importance of the case manager, who, with the help of agencies, tries to coordinate all these services and make these services available to the client, so that the client get necessary services in all the aspects of his life. Before we break for lunch, what are two main services? They are fragmented services and coordinated services. Fragmented services means the services are not aligned properly. It's like misalignment of services. Services are here and there. Even within the facility and outside facility. You see, for example, the center may be functioning in a big hospital, and the center is situated in a particular floor. Maybe it is in the first floor, and the HIV counseling services is located in the 5th floor of the hospital. That means the client, for him go to, he may not be knowing where to go, to approach, and even how to approach the counseling services in the HIV clinic. So within the facility, even he may find it access to the services that are freely available in the hospital. So that is how you coordinate and give services. So if it is not properly coordinated, not properly aligned, we call it fragmented services. Fragmented means lack of coordination. The service providers do not work together. That is what is called fragmented services. They don't function as one team. So the client is not able to get all the needs that he wanted or he wants. So that is fragmented. Here and there. That's the meaning. Not aligned, not coordinated. Now, coordinated services. Coordinated services means services that are put together, that are aligned properly, is a person, a point of contact, who brings together all these services and makes it easier for the client to access various services. He has a client where he says whom to approach, how to approach, when to approach. So this is very clear. All the people or the service providers who are involved in the services giving will work together as one team to provide services to the clients. Services like medical services, mental health services, schooling, that is education, job training, placement services, legal services, etc. So that is called coordinated services. When it is not coordinated, it is called fragmented. Now, we shall have a small breakout, I mean just 10 minutes discussion. You can all read what is fragmented services and what is coordinated services in your participant manual. Please go through it, have a discussion, come up with your own ideas. What is fragmented service and what is coordinated services? So, Thai group may discuss fragmented example of fragmented service. You can the practices in your country, whether you have case managers, whether case management is taken care of in your facilities. All the other group can discuss coordinated service. That's a Myanmar group. Please discuss the meaning of it. Tell us in detail what is coordinated services. Give examples. Also, tell us about case management system in your country. How do you do it? Whether you have case managers in your facilities. So let's break now. We will come back by within say 10 minutes. Enough for discussion? You want 10 minutes or more than that? Hello? Enough. Okay, very good. So take 10 minutes. Chit, please break into rooms. I mean, please break the rooms. I mean, to Thai and Myanmar.
Okay, Professor.
10 minutes. ഇവിടുത്തെ ഇതെന്തേ ഈ നമ്പറിൽ വിളിച്ചിട്ട് പറയാം 47 50 14 62
Kuaka, please join session 2, no? Hello, Professor.
Okay, back. I don't see some of my friends there. You're all there? Okay, let's start. Which group wants to start sharing? Thai or Myanmar? Any one of you can start, please. Who will start? Show your hand, please. I heard your discussion, but I could not understand much. Of course, as from the Thai group, Myanmar group, I saw the presentation. Arkar, are you going to share? Go ahead. Please share.
Coordinated. Can you see the slides?
No, slides we can't see. It says only use.
We see only just gray screen. Maybe you stop sharing and share again.
Okay. Okay. Can't see.
Can see?
Okay. Oh yes. Okay.
Can you see the slides
Yes,
now?
yes. Now we can see.
Yeah.
We were asked to talk about coordinated services and what it look like in what coordinated services like in Myanmar.
Okay. Okay.
The definition of coordinated services is the uninterrupted services that are integrated among service providers.
Okay. Okay.
In the central government level, cooperation and collaboration among government ministries, such as Ministry of Health and Sport, Ministry of Social Welfare and Social Welfare, Relief and Resettlement, and Ministry of Home Affairs, and the other regional governments for prevention and treatment of SUDs.
Okay.
Well, I think it will work. And in the hospital setting, we can cooperate with other specialists and therapists for the care of SUD clients, and we can provide integrated care to the patients.
Okay. Very good, Arka.
Thank you, sir.
Okay. So you just discuss what is coordinated services. Coordinated services means the services that are not interrupted. You are right. Those services which has a higher level of cooperation among the service providers, and it is integrated. That is very important. You are marking that. I definitely agree with you. This is what is integrated services. So, do you have a case manager who works as a single point of contact, who coordinates all these services for the clients? Do you have?
I don't have the addiction or psychiatric training, but as far as I'm concerned, there is no case manager for SUD client in Myanmar in government hospitals. I think the same is true for private hospitals in Myanmar. For most of the clients, the psychiatrist played as the case manager for the clients. I think.
Oh, okay, okay, Arka. But after we discuss this concept, case management, you can think about having a case manager, not a doctor, because psychiatrists and other doctors must be very busy with other work. This case manager can be a counselor, a person who has done counseling courses enough. He can be a social worker, who has better interrelationship with the service providers, both NGOs and organizations, so that we can coordinate all services for the welfare of the client. Example, in your facility, there are services. The client may not be about these services. Help the client obtain all these services. That's the coordination. Outside your facilities, I mean agencies, outside of your agencies, like your agency need not necessarily have legal aid services, employment opportunity, educational facilities, etc. As a case manager, you can coordinate all these services by maintaining effective relationship with these service providers. And when you do all these services, you bring together, you coordinate all these services for the welfare of the client, we call it coordinated services. Is it clear to all of you? Hello?
Yes, Professor.
Yeah,
I think he still doesn't have the necessary system and infrastructure to properly and effectively address the SUD problems. We still lack
yes.
necessary system infrastructure. That's why I'm not familiar with the most of the concepts discussed in this training program.
Very good, Darka. Yeah, your country may not, but we can, I know, when on new systems, new concepts, we can try to integrate it. We can try to incorporate all these services into our system. Of course, many of our Asian countries do lack a lot of things with regard to addiction treatment. So let us try to bring effective system to our facilities and provide effective, fruitful, and better treatment care to our clients. Okay, thank you very much, Aka. Thank friends. Take your own time and test, then we will break for lunch. Bye, friends.
Yes.
Please.
Professor, we'll take
Yeah.
a break.
Yes. Bye, friends. Just tell us about fragmented service.
Okay. In Bangkok, fragmented is the way to provide to is the way to service to greater integration of systematic healthcare by case manager to provide patient preference. Example about knowledge, other health service, occupation, or etc.
Okay. So you have the what you are telling. Am I right?
Yes, we have. Yes, we have
Okay.
the system.
That's very good. So fragmented means actually what you understand fragmented.
Pardon?
Fragmented services means what?
We have
Pardon? Did you discuss what is fragmented service? Hello? Can one of you tell us?
Yes, I'm sorry.
Yeah, just like we have several kind of services provided by several government sectors, but not coordinated together.
Oh,
But we can just like we can collaborate. Just like okay, I can just refer to other government sector, but not really have like full of case manager.
Oh, okay. Proper coordination, proper alignment
We have
of the service. We call it fragmented services. Okay.
yeah, okay, but so we're not sure then if we have like a fragment, because we kind of have like a very good coordinate, not really coordinate, you can just connect to other sectors, but not have a case manager.
Okay, I understand. You have a lot of services available in your country, but
Yes.
you exactly do not have a case manager system. Who can work as a single point of contact. That's what you are telling.
มีบางที่ใช่ป่ะ
Not at all. Some of center, we have 84 centers. Some of center have a case manager also, like a counselor, psychologist, or social worker or nurse.
Oh, that's very good. That's very good. That means you are updated yourself. You have better services. May not be in all the facilities. In some facilities, you have case managers. So that means you are doing coordinated services. So let's all strive to do coordinated services for the welfare of the clients, and let us work together. Working together is what is called case management. So let's break for lunch and then come back after 1 hour. Thank you. Have a good lunch.
Thank you,
Have a good
Professor.
lunch. Thank you. Thank you,
See you
all
after
my
lunch.
friends. Yeah. Good.
I'm sorry, I have a question. So how long that we can take our lunch? 1 hour?
Okay.
On 1 hour? 1 hour?
Okay.
Okay. Thank you.
Thank you.
Good. And you?
I'm doing very well. It's Christmas. Almost Christmas.
Oh, we cannot celebrate because in Thailand we found a new cases.
Oh.
Yes, it may second. I'm not sure that we could announce second round of spread or not, because we found nearly 1,000 new cases, around 800 cases.
Okay. But in India, we have more than that.
Sure. Oh, hope you stay safe now, Dr.
Don't worry.
Francis.
You know, I work in a medical college.
Sure.
Yeah. But
Yeah.
we are not afraid.
Yeah.
We will win the game. Yeah. So take
Yeah,
care.
and support your client also, na?
Yeah.
Uh-huh.
Take care. Take care. You must wear a mask. Take care all the precautions.
Yeah, and hygiene.
Hygiene is very important.
All right.
Washing
Right.
hands, keeping mask. All these are very important.
Yeah.
Training going on. So far, okay.
I hope everyone ready. Health department, are you ready? Health department, are you ready? Please open your microphone. Yeah, unmute, please. Are you ready? Dr. Francis, ready? Oh, great, Dr.
Yes,
Aka.
great.
Yeah.
Aka is there.
Oh, yes, good visit. Okay.
Yeah.
Have fun,
Yeah, very
Dr.
good.
Francis. Have fun your class. Bye.
Okay, let's go ahead. Okay, friends, we start. Okay, good. Let's start. Okay, we discuss coordinated as well fragment services. We know that that is case management. What is case management. And as a prelude to the discussion, we already discussed two important concepts in case management. They are coordinated service and fragmented services. When services are coordinated, we call it coordinated services. And that is the aim of case management and the responsibility of the case manager. Of course, this concept has not been very effectively implemented in some of our South Asian countries. Because we are in that infant stage. We are still in the beginning stage. And also, SUD treatment it needs a lot of money, lot of resources, unlike what others thought earlier. So these concept in our mind, let's start the module 2. There are 4 modules in this particular course. The first module we already discussed. The second module will be discussing definitions of case management, why case management is a need, principles of effective case management, and functions of case management. I say once again, in this particular module, we shall be discussing what is case management, that we shall try to define case management. We will discuss why case management is needed, why it is necessary as part of our treatment for SUDs. We shall also just discuss principles of case management and functions of case management. So let's start with a definition. Can any one of you give us a definition of case management? Or just say, need not be very scientific. Just in your own words. Let's have a small discussion. Come on. My Thai friends and my Myanmar friends, let's discuss what is case management. Definition. In your own words. Please do not check your participant manual. Let it come from within us. Come on. Get ready, please. Okay, at least one of you. Please give a definition. Very good. Thank you. Are you still awake? I doubt none of you are speaking. Are you sleeping? Are you sleeping? Okay, come on. Just tell us what is case management.
Oh, okay, Dr. Francis, as the from the point of view of management, managing is to make things done so that we are helping in case management. We are helping the client to achieve his goal.
Okay, right. We are trying to achieve, trying to help the client achieve his goal. Okay, fine. Do we help only the client or the family too? In the process of case management, do we help only the client or the family as well?
Yes, the other connected are, the causes are making the client suffer, so that we not only handle or we not only focus on the client, we also make a certain consideration on the matters connected with his sufferings.
Very good, Dr. Tin. You are absolutely right. Helping the client meet his needs, we also coordinate the services for the family too. Whatever possible services we can provide. As I said, services like medical care, mental health services, HIV, education, job training or job, that is placement, food, housing, legal aid for those people who are facing cases, or there are pending cases against them, or they are in the jail, or they are still being under persecution. All these services within the system, that is the facility, the treatment facility, or outside the facility. Whether it is within the facility, outside facility, as part of the case management, the case manager brings together all these services and helps the client obtain it as and when he requires it. So that is the case management. And we also help the process. In the process, we also help the family. The family may be wanting housing. The family as a whole needs some legal help from us. We coordinate these services from various agencies or within the agencies. So now let's share the slides and see what is it. Okay. Can you all see the slides? Dr. Nida, Tin, our Arka, and
Yeah, you can see the slide, Professor.
very good. So as I said, we will be discussing definition. We already discussed why we should have case management, or what are the reasons for using case management, principles and functions of case management. Now this we already did, this exercise we already did. Now let's see the definition. You can see the definition there. Assessing the client and client's family. So the case manager, like a counselor, first assess the need. First assess the need of the client as well the family. When appropriate, arranges, coordinates, monitors, evaluates, and advocates multiple services to meet the client's need. So the client has a complex needs, multiple needs he has to meet. After making or evaluating or assessing the client's needs and the family as well, the case manager, in a proper way, in an appropriate way, coordinates and monitors and advocates for the multiple needs of the clients. Just put it in a nutshell. The case manager, having been assessed the need of the client and the family, is that he can get for the client. So he is like a coordinator. But here the coordinator means not that whatever the client wants, he assesses it properly. And then in according to the need of the client, appropriately, he coordinates and monitors. Let's go to the next. What is the difference between counseling and case management? Can you please tell, at least one of you? What is the difference between case management and direct counseling services? Hello? Hello?
Okay, I think case management refers to the coordination of the external resources for the management of the client SCD problems, whereas the direct counseling services are internal issues, meaning it deals with the
feelings and
patient
emotions.
mental- yeah, patient
Okay.
inside feelings and emotions, I think.
Okay, okay, Tin and Arkan, both of you are right. Both of you are right. Counseling is helping the client to handle various aspects of his emotions, addiction. So the individual sessions are given using various therapies like CBT. Whereas case management, of course, it also does assessment of the client's needs. But case management is bringing together all the resources and making it available to the clients. One is a coordination, the other is a kind of therapy given. Can a counselor be a case manager? As a case manager? Somebody can speak.
There is a limited human resources. I think a counselor can be a case manager, but if there is
Very good.
If there is a proper system and infrastructure and human resources, I think manager is a position that should be separately assigned.
Exactly, Arka. In a facility where there is a lack of resources, particularly money, then a counselor can play dual roles. A role of a case manager as well as a role of a counselor. But in a facility where there is enough resources to appoint a case manager separately, that is fine. So the case manager can exclusively work or function as a case manager. But remember, in many of our countries, particularly South Asian countries, the counselors work as a case manager, or the project director or the project coordinator or the program coordinator work or function as a case manager. So please, the difference is one deals with internal issues, providing therapies and counselings, that is the counselor. Whereas case manager coordinates the resources and make it available to the client and the family. So that's the difference between case management and counseling services. Intra-program and inter-programs. Intra means within. Intra means within the organizations. Say, take an example. Solace, an NGO working in Malaysia. In that facility, they have certain resources like counseling for individual and family, HIV clinic, medical care clinics, etc. So those services that are available within that particular NGO or facility or institution, we call it intra. Generally the outpatient to the residential clinic. In the facilitating services from outside the agency, that is from the community. Example, referring cases to family therapy, HIV clinic, job training centers, referring a client to an advocate for legal aid, referring a client to a housing agent, an agent who provides loans or fund for housing. All these are called inter programs. So a case manager is supposed to coordinate both intra and inter programs, meaning he has to coordinate the services within the organization as well as outside the organizations. This is very simple, so let us go. Why case management? Why should we have case management? Case management is needed to boost or to improve the client's motivation and engage the client in treatment. Simply meaning, if a client understands that his services are easily met, he would be willing for treatment. When a client knows that that particular facility, all those needs that he may be requiring or wanting, he would join the treatment. He would engage himself for the treatment and his motivation level goes higher. So that is why we need case management. Case management will help the client improve his motivation as well as engage in treatment. Second point is, case management is needed to provide the client appropriate services. An SUD person, a person with alcohol or drug using problems, may have so many needs. So many needs like food, clothing, housing, etc. So if a treatment facility will provide him the appropriate services, appropriate needs, then the treatment services are better, effective, and will have a fruitful outcome. Case management is also needed to build the recovery capital of the client. A client may not be having very strong recovery capital. He may be lacking finance. He may be lacking financial support to go to faraway clinics. So a case manager coordinate all these services, help him build his recovery capital stronger and stronger. Again, case management is needed to coordinate the services, prevent fragmentation, meaning the services are spread here and there. It is not coordinated properly. A case manager can bring all these services together and provide the or help the client meet his needs. Case management will help the client move from one stage of treatment to the other stage of treatment, from the primary treatment to the later treatment of continuing care, etc. So smooth transition from one stage to the another stage of treatment is made possible by case management. Case manager can also help the client reduce the barriers. Example, I tell you, a client may come to your center for treatment, but he may not be supported by enough financial fund. There may not be anybody to look after his family. So if the case manager can help the client, the resources from the community and support his family, the client can take a proper treatment and overcome the barriers that are involved in taking treatment. Now, recovery capital. As we know, recovery capital is very important to maintain sobriety or to sustain recovery. What is recovery capital? Where did we learn about recovery capital? Can one of you say? Hello?
The recovery capital is the resources that can help the client in the process
okay, come on, please. Hello? Hello?
Yes, we can hear you.
Yeah. Okay, you can speak. What is
the recovery capital is the resources, any resource that can help in the recovery process of the client.
Very good. In other words, the assets, the strength a person has, the resources that are available to him. And this concept in course 2. Do you remember? In course 2, we learned about this. So recovery capital, one is personal recovery capital. Can any one of you say what is a personal recovery capital? That is physical as well as human. Can one of you give us an example for physical recovery capital?
Physical recovery capital is tangible.
Yes, tangible.
Whereas human recovery capital is intangible, like values, beliefs, etc.
Ah, very good, Arka. Thank you. Good clap for you. Human means values, principles in life. Physical means the physical health. All these can be physical values. Family social recovery capital. Can you say one example for family recovery capital? Hi friends. Hello friends from Thai. Can you please tell us an example for family recovery capital?
Relationship in the family.
Yes, relationship in a family. You are right. The supporting, the support from the spouses or parents or children, all called family recovery capital. And community recovery capital, can you give an example? Community recovery capital.
Understanding the patient.
Yes, understanding community. Have you learned about social stigma? So I am asking you a simple question. If there is social stigma, is it a lack of community recovery capital or is it a recovery capital? If there is social stigma in a community, is it a recovery capital or not a recovery capital?
No.
Recovery capital.
Very good. Very good. Keep it. Community that supports SUD as a issue and a community that provides care to the client is a good recovery capital. So a case manager should help the client develop or build his recovery capital. So mainly the types of recovery capital are personal, family social recovery capital and community recovery capital. This is a partner exercise, but we are on virtual training and it is not possible to do. So I'm just skipping it. Principles of case management. Single contact, advocacy, community-based, pragmatic, anticipatory, flexible, culturally sensitive. So there are 8 and let us go one by one. Single point of contact. Single point the case manager works as a single point of contact. He is the one who coordinates and directs like an anchor, means showing the right path. So he is the person every other NGOs or other professionals coordinate with. Or in other words, he coordinates with all other professionals within the organization, that is the Indra program, or he coordinates with other agencies and professionals outside the organization, what is called Inter program. So he is the single point of contact who coordinates all other services for the client. So that is the basic principles of case management. Second is client driven. Client driven means case management functions in accordance with the client's needs. Client's needs are given importance. Based on the assessment of the client's needs, the case manager functions. Case manager should concentrate only on the client's needs. That is what is called client driven. Advocacy. The case manager check the interest of the client, speak on behalf of the client. Doing advocacy means speak for someone or support someone. So advocacy is the process of speaking for the client, promoting the interest of the client. That is advocacy. Community based means helps or services or program transition is based on the community, the local services. Through the community, the needs are met. That is community based. Pragmatic. Pragmatic meaning practical. Case management works on a practical ground. What is possible and what can be met as an immediate response. That means if a client comes to your center for treatment, what is his first need? The first needs are met first, then the other needs are met. So based on a practical priority base, the needs are coordinated. When a client comes to our facility, his first need may be handling withdrawal issues. Food. To me, it is not withdrawal issue. To me, it is food. If a client comes to our center and he has no money to eat, he has no money to, and his priority is getting enough food. So the case manager must coordinate that need. And that is why case management is based on practical based. It is based on priorities. Anticipatory means case management foresees or anticipates the needs during the treatment. What does it mean? Can some of you say, in SUD treatment, what is the case manager anticipates? One example, can you say? Anticipating a need. Hello? Can you think about an example for addressing or foreseeing a future problem? Immediate or foreseeable or future needs that a client may have. Can you anticipate? Can you foresee it? Hello?
Yes,
Hello?
case manager must be very much aware of the natural cause of SUD and
Yes.
the nature and the behavior of the SUD clients,
Yeah.
because the SUD clients have they may relapse, they may have co-occurring mental disorders, they may have so many problems other than the substance use disorder.
Yes, exactly right, Arthur. And I appreciate you. The very first need of the client when we consider the natural causes of SUD is relapse prevention management. How do a client manage his relapses, if any, in the future? Likewise, how many other needs are there? So this is how the case manager is able to anticipate and provide a solution to the need. Flexible simply means case management manager must able to adapt and provide the needs in accordance with the client's needs. Client may have various needs and it has to be flexible. It should not be very rigid. Means case manager is not the one who decides on it. It's the client who may have different needs and the case manager may able to adapt into the needs of the clients. Culturally sensitive means any case management system work on the prevailing culture of a community where the client lives in. An example is, if the client is having a mental health issue, say depression, and if in that community mental health is considered not good or considered as a social stigma, the case manager should take care of this stigma attached to it, and when he makes a referral to refer the client to any centers, he must make sure that the client does not suffer it, because that particular community has a lot of social stigma with regard to mental health issues. So this has to be kept in mind while referring a client to a community mental health treatment places. So this is very important while coordinating the needs of the client. Confidentiality, very simple. We have been speaking about this since the session started, since the course started. Simply, confidentiality means whatever discussed, whatever planned, whatever arrangements made needs to be kept. The clients, his friends, his family, with regard to laws, with regard to pending cases, with regard to anything that is associated with the client and his family, should be maintained confidentially, or confidentiality needs to be maintained. Now we come to the functions of case management. There are 5 functions: assessment, planning, linkage, monitoring, and advocacy. Assessment means assessing the needs of the client. Planning means how do we identify the resources and how do we connect it to the needs to the client. Linkage means how do we refer the cases to, and how do we connect the client and the resources that are available. That is linking within the agency as well as outside the agencies. Monitoring means making sure that the client gets all his needs. Example, if you refer a client to an HIV clinic, the case manager should monitor whether the client went to that clinic and the client received services from that agency and he is satisfied with the services of that particular agencies. That is monitoring. Generally or usually what we do, we refer a client to a resource centers, but we never check or monitor whether that client could avail that particular services and whether he was satisfied with the services provided there. It's not the case in case management. In case management, the case manager makes sure that agencies within the organization and the organizations are support and the services. And when there, he received the services, all these things he monitors or evaluates, oversees. Advocacy. That's the 5th function of the case manager. As I said to you, advocacy, supporting someone, speaking on behalf of the client is advocacy. An example, a pending case in the court and he is unable to attend the court proceedings, and then the case manager talks to the lawmakers or lawkeepers or whoever is that particular issue and probably help the client go there, address his problem, or that particular agency understand about the inability of the client to attend the court. So advocacy is the case manager speaking on behalf of the client, speaking for the client. That is called advocacy. So all these things I explained. Assessment I explained. explanation. We will just break and we will have a small break room sessions.
Yeah, Dr. Francis, may I mention a little bit?
Yes, please, ma'am.
Hello,
Report.
Dr. Francis. Yes,
Yeah,
yes.
please.
For a case manager, yes, for a case manager, example of the case, the unsatisfied counselor, do the case, do the client report to the case manager that I'd like to stop this counselor, or please change the new counselor because I feel like unsatisfied his services, something like that. Do the client can report to the case manager and the manager change the counselor?
Oh, very good, Prapon, Dr. G. You really a good example. This could happen in any treatment facilities. The answer is definitely the client can talk to the case manager. But as a rule, be comfortable enough to talk this particular issue to the counselor himself or herself. If the client is not comfortable to talk to the counselor himself, there is nothing wrong. This issue can be brought into the case manager. And case manager in turn can discuss it with the counselor and then make the necessary arrangements for the client to see another counselor within the treatment facilities. In case the client is not satisfied with any one of the counselors in the treatment facilities, the case manager can also arrange another facility and another counselor in another facility for the client's need. Because the very concept of rapport, faith in the counselor,
Right,
and the comfortability,
right.
the confidentiality are very important. So within the facility or even outside the facility also,
Right.
the case
Thank you.
manager can coordinate. Thank you. Yeah. Any other very good for bringing up that issue. I wanted to speak it at the end of the session, but you brought it down. That's why I didn't forget also. Thank you very much, Dr. Prabhat. Can we have a break? Break room and have a discussion? Hello?
Yes, we can.
See? Yeah. So the Thai group, please discuss the first 3 points. Assessment, planning, link. Thai friends, please discuss first 3 functions of case management. That is assessment, planning, linkage. My Myanmar friends may discuss monitoring and advocacy. Let's have a how many minutes? Okay, fine. 5 minutes. Just 5 minutes enough. Is that okay? Okay, please break into 5 minutes discussion. And then we come back and close for tea. Dr. Chit? Yeah.
Yes, I'll break in a minute.
Yeah. Okay, good. we are back. Did you all finish? The Myanmar group finished, I know. Thai group, did you finish? The Thai group finished? Yes.
Yes.
Okay.
Yes. Yes.
Yeah. Okay. Hold on. Hold on. I think we will break for tea and then we come back and present it. Is that okay?
Hold on, please.
Okay. Okay.
Shall we
How many minutes?
break for tea? Yeah.
Okay.
How many minutes?
Okay.
15 minutes. 15 minutes break. Have your tea and then come back.
Okay. It's
Good.
okay.
Okay.
Yes.
Okay.
Thank you.
Tell us what you discussed. I see some of you are very busy with the font. Discussed.
Health Department ค่ะ Health Department ค่ะเชิญเลยค่ะ พร้อมนำเสนอเลยค่ะ Health Department ค่ะ ตัวแทนจากไทยกรุ๊ปค่ะ เชิญค่ะ Hello
Yes, please.
ปณิดา ใครเป็นคนนำเสนอปณิดา ทางฝั่ง Health Department please unmute your microphone Hello Oh nobody answer me พี่ปณิดา
Yeah, because come on, join for discussion.
ทีมกทมค่ะ ทีมกทมค่ะ เชิญค่ะ เชิญนำเสนอได้เลยค่ะ ทีมกทมค่ะ ทุกคนรอทีมกทมอยู่ค่ะ ตอนนี้เปิดไมค์เลยค่ะ เปิดไมค์แล้วนำเสนอเลยค่ะสามประเด็นที่เราได้รับการ assignment เมื่อกี้นี่ค่ะ พร้อมไหมคะ
พร้อมครับ
พร้อมนะคะ โอเค yeah good start
Okay, sorry, we have an accident with our electronic device. Okay, as your assignment for us for assessment, planning, and linkage, yes. We're gonna start with assessment. Assessment is understanding all the dimension of the person and the complication of factor to prioritize the problem of the person. Then planning is an integration of the data from the assessment to set action for core of the person problem or respond to their needs. Final linkage is the connection to other service or other way to solve the problem that over the limited of the service or over the ability of the case manager.
Okay. Others? Did you discuss all the 3 points?
Yes.
Okay. So the first point you discussed assessment. Okay? Okay. Assessment, what are you assessing?
Again, please.
What are you assessing? Assessment you do.
ลองยกตัวอย่าง assessment ที่ทำอะค่ะ
For the assessment, we assess about the social factor, the psychological test, and the medical examination.
Very good, doctor. You do basic assessment like medical issues, mental health issues, emotional and cognitive issues. You can also assess other needs. Other needs like housing, whatever it may be. So the priority needs. What are his priorities? What is the next point after assessment?
Planning.
How do you plan? Planning means what?
Planning is we indication the result of the assessment, yes, to set an action for solve the problem of the people or respond to their needs.
Okay, so you are planning what are the strategies to meet the needs, how to be done, procedure should be, that is planning. Okay, is that okay?
Yes.
And what is the third stage, third function?
The third one is linkage.
Okay, what is linkage actually?
Linkage
Another one. Yeah.
We believe that linkage is very important because it is the connection to other service or other way to solve the problem that over the limited of the service or over the ability of the case manager. So that we have to require to help we require the help from the other section to help our case.
Okay. Right. Linkage within the organization or outside the organization?
In especially is both of them. Yes.
Yeah.
In our organization and other organization.
Yes. Correct. And most often the linkage that you have is with other organizations, like contacting outside agencies for various services. Can you tell us what are the services of other agencies, like?
Maybe like knowledge, study, and about the so all of us is work in the primary health center, so that we
Okay.
have not advanced in the about some action of the medicines, so that if we need for the help from the advanced service, like a medical advanced service, we have to refer to the bigger hospital, or about HIV, or about the problem about lung. Yes.
Correct. You are correct. Our yeah. Tell please.
Maybe to some help like the foundation. Yes, like have for homeless, for have the migrant, something like that they have a problem. Yes, we have to help them to help them in the way of life in every day.
Exactly right. You are absolutely right. We are trying to find services outside our agencies that are available, and further connect to them. Linkage simply means connecting to other agencies. Linking, connect. That's the meaning. So the case manager works as a coordinator or a mediator who helps the client meet their needs, which are within the organizations or outside organization.
Yes, I think one. Yeah. I'm sorry, Dr. Francis. I think one important thing is the linkage should provide the client needs, because we may have a limitation in our facility. For example, if the client needs a point about the yoga, so in our facility didn't have the service of yoga, so may we refer to the yoga organization, something like that.
Yeah, it is you refer, but how do you maintain the linkage? You are having a good interpersonal, inter-agency relationship with other organizations, so that your organization can easily refer the cases to other agencies and help the clients obtain those services or avail those services. So he is like a spokesperson. He is like a person who goes there, talk to them, do all kinds of advocacy, all these things with other agencies. So that is linkage. Very good. Anybody else would like to speak on assessment, planning, and linkage? There are 5 functions. One is assessment, second is planning, third is linkage. Is there anyone who would like to speak on that? Did you all understand? Is it clear?
Yes, we have no question.
Okay. So let us go to the next. Let's go to the next 2 stages. I mean 2 functions. They are monitoring and advocacy, which our Myanmar group will discuss. Myanmar group, my friends, you are welcome. Please.
Monitoring the process of checking whether the client is doing as the treatment program, or is there any difficulties in doing so, and monitor the client's improvement during the treatment, and also check any further problems or services the client needed during the treatment. For
Exactly.
example,
Yeah.
do I need to present a case?
Yeah, please. You are welcome, sir. We have time.
For example, I would like to present a drug-addicted client. He went to his counselor regularly at first. Then he didn't go to the counselor. It was found that he lost his job due to gastritis. He can't go work.
Okay.
So this is the monitoring of my client.
Okay.
Advocacy is the solving the problem instead of the client. If the client cannot solve his problems, in that case, I will negotiate with the employers by explaining about the client condition to get his.
Yeah. Okay.
Yeah.
Okay, sir. You are right.
Yeah. This is the advocacy.
Okay. 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 Anything else? Others would like to speak on? 5 functions of case management: assessment, planning, linkage, monitoring, and advocacy. Monitoring is very important because whatever services that are available that could be availed by the client, the agencies are often did receive those services, did try to avail those services. Is important. The agencies which are supposed to provide the services to the client, whether they did provide the services, did those agencies keep their words, did they provide appropriate and effective services to these clients, and whether the services the client received was okay, did that serve the purpose, was it useful for the client, did he to that were available. All these areas of effectiveness and availability of services needs to be monitored, supervised by the case manager. is one of the very, very important functions of case management. Of course, all the 5 functions, case management, assessment, planning, linkage, monitoring, advocacy. All these are very, very important. But if you do all other 4 and then you don't do the monitoring, no, your case management is a failure. Is one of the very important functions of a case manager or a case management. And then advocacy. Advocacy, as the word says, speaking for someone. You are talking on behalf of the client or for the client. You can do advocacy with other agencies. You can do advocacies within the agencies. All these areas you can do advocacies. So I'm just summing up. The functions of case management are very important. Based on the functions, the case manager is supposed to assess the client's needs, particularly medical, mental, emotional, cognitive areas of his life, and then plan it accordingly, and then link it, then do the linkage, and then monitor what has been doing and what is going on, and then do. So that's all about module 2. Now we come to module 3. Module 3 discusses models of case management. This is very interesting topic because how the case management in different models works and what works for our country is also very important. So let's check the models of case management. Can you see the presentation? Hello? Okay. Let's check. So in this particular module, we will be discussing 4 models of case management. Which models is used in your programs, whether we can change according to the needs, and how these models works. So basically we are discussing what is it. The 4 models of case management. Strength-based, clinical or rehabilitation, assertive community treatment model. I will discuss it one by one. One is brokerage. Brokerage or generally simply meaning the case manager helps the client identify the facility and then connects to it. Case manager only helps the client connects to the particular
Oh, do we lose Dr. Francis?
Yes, I think so.
Yes, yes,
Because
yes.
I thought it was my connection, but it's not.
No, no. I think he has problem about the internet also now. So wait. Okay.
I think we lost the connection between. Did we?
Yes, yes, we lost the connection.
Okay. Sorry. Yes. Just hold on. Okay. You are discussing case management. Oh, no. Sorry. That's not the thing. Just hold on. Okay, now I can share. Just give me a few seconds. Oh, sorry, that's not the one. Okay. Can you see? Oh, okay. So we were discussing about models of case management. Models of case management. Same. First is brokerage. With the very word is you work as a broker. You connect the client to the agency. You give all the information about the agency to the client. And the client chooses from where he needs to take treatment. And he should take. The client chooses. This brokerage. The function of the manager is to connect agents. Once he that he stops his work, his functions. The second is strength-based case management. Management, as the meaning, it is based on strength of the client. Whether the client has what strength. Based on his strength, he chooses the treatment or the services are made available to him. clinical or rehabilitation model means it is in a residential settings. That's basically clinical. And in the clinic, the counselor can be the case manager. Work as a case manager. The manager in the model of called clinical. And assertive community based means the community is more important. The treatment, the services are provided within the community. That is the community based model. The services in the community. So the client can avail the services in his community. That is the model. Are you okay? Do you get me? Are we still online? You can hear me? Is there any issue? Okay. Brokerage. We go one by one. Brokerage means negotiating services for the client. As I told you, the case manager talks to the service providers and connects the client to the service provider. After assessing the client's need and requirement, the case manager helps the client to get contact with the agencies. That is called a brokerage. It takes very less time. It's a very simple method. Here, the duration of the contact is just linking the service to the service providers. That's all. The case manager only connects the client to the service providers. He makes a contact with them. Then it is finished. There is no monitoring. There is no advocacy in the general or brokerage model. So the case manager does not function as a advocate, or the functions such as monitoring and advocacy are not part of the brokerage. So that is brokerage. Advantages are, it is very simple. Case manager is linking the clients to the service providers. The services are very narrow and takes only limited resources. And this is good for clients who are not very economically deprived. They have sufficient resources. This model is good for clients who have sufficient resources, who are wealthy enough, so that the case manager functions as only a linking person. He does not do monitoring and advocacy. The case manager's functions are very limited in this model of case management. Let us always remember the challenges. The challenges are, it is like less advocacy, and it is useful not in the later stage or in the beginning stage of SUD. Because in the late stage of SUD, the client as a person is not capable of taking decisions. So this model is not suitable for the late stage of SUD. Any doubt about general brokerage? Any question? Hello? Hello? Hello, friends? Okay, good. Let's go to the next one. Strength-based. As I already said, focus on the strength of the client and the family. Here the case manager works as a consultant. He helps in accordance with resources that are available to the client. This model is good for clients who are active, who are active, whose family empowers and helps him. People who are skillful and who have strength and confidence can approach or use this model. In this model, there is a kind of advocacy done. Strength and capabilities are basically the focuses on this model. Here, the client has a disease, but the focus is not on that. The focus is on the potential of the client to handle that particular situation. So, whether the client is able to do that, whether the client has enough sufficient resources, whether the client has family support, all these things are checked, and based on that, the treatment or case management is done. Remember, clients with late stage SUD or in very early recovery often have inadequate strength. We have to keep in mind early stage and the late stage. Next one, strength-based model does not work for all the clients. And clients who have not reached the late stage may do well. Sometimes what happens, if you do advocacy and client-driven planning for the client, it may not work for the clients, all the members, because it's based on strength-based model. This is a discussion. We will not have that discussion. The next model is model is that is happening in hospital settings or residential setting, where the clinician himself is the counselor, or counselor himself can be the case manager. So he undertakes the mobilization of the case manager, works as a case manager or function as a case manager. This is maybe more suitable for all of us, because I think this is the one of the model that we are following nowadays. This is more or less what is happening in our countries. This model has a therapeutic relationship between the client and the client, and this is a long-standing relationship. Also, this is one of the widest used models in the world. Challenges. Challenges are the counselor does the dual role for the clinician, and therefore the case manager who functions as a counselor and the case manager he has to be a person who can function or who has to be multiple tasking. That means he has to do both the work of a case manager and the counselor or a clinician, and therefore he needs a lot of training. And as because of that, the involvement of advocacy and coordination, that means since the counselor or the clinician is doing the role of the case manager, he may not get enough time for advocacy. So advocacy is very less here. So that is clinical. This clinical model is good for women clients because this gives a lot of empowerment. Here, one member is handling all the team. Sorry, the team is handling, and it is the team that is responsible for all unique needs to address. Assertive community model. Assertive community model is what we call the individual responsibility or individualized treatment. Sorry, individualized treatment directly given in the home atmosphere or community atmosphere by a group of multidisciplinary people. That means the treatment is provided within the community, where the community is capable of handling the issues. The community has enough resources. The case manager collaborates all these resources for the support me services of the client. It's a 24-hour services. There is no specific time limits. Sorry, there is specific time limits and goals are established at the beginning of the treatment. That means before the treatment starts, everything is clearly defined and mentioned, and then the treatment starts. What is the difference between this clinical and assertive community is that clinical model is provided in a hospital settings or in a residential settings, whereas ACT, assertive community treatment, works in a community and it focuses on individualized treatment. These sorts of treatment model can help relapses, can meet the basic needs, function very well. All services like medication, SUD, group therapy, all this can be given at the community level. Advocacy for employment, education, housing, all be done without much effort because the community is also involved in the treatment process. So a client who has the needs of housing or employment or education or other needs can meet the needs in a better way because the community is involved in this model of treatment. So that's all. What are the challenges? Challenges are a team is required. A team, a full multi team is required. And you may have more cases to handle. So you have to be, resources may be needed. The whole team has to be involved. And one of the challenges is transportation is a very essential thing. Why transportation? Because the whole team has to go to the community. Lot of things has to be brought in and brought out. Medication, other facilities, food, everything. Of course, if these things are made available in the community itself, that is good. That is there. But the team needs to go there. And therefore, this is one of the biggest challenges for the ACT model. Some of the examples of ACT. ACT can be used in a different settings. People like homeless, very severe mental illnesses, and people who are injecting drug. Why it is for the homeless? Because you can go to their street where they are living, and that area you can come with the help of a community. Severe mental illness in rehabilitation areas where they have problems, and drug using people who cannot come to the hospitals, you can go there and conduct. ACT team in USA provides services for SUD treatment, later prevention, finding employment, medical, HIV related issues. That's all about what is happening in USA. The ACT provides all services like prevention, finding employment, medical services, HIV related issues, 12-step methods. And here in ACT model, the importance of the case manager is like a single point of contact. Actually, one person, like an event management system. The case manager manages all team, the client, and the community. So his work is much, much more. Any question on the models of case management? There are. Hello, can you hear me? Can you hear me? Okay. There are 4 models of case management: brokerage or generalist, strength-based, clinical, and ACT, assertive community model. Okay. Now, if you have any doubts, please ask me. Otherwise, because we are running short of time, we have limited time. Shall we have a group discussion? A break room for 10 or 5 or 10 minutes so that the concepts are clear to us. Shall we break? Hello? Shall we break for 10 minutes? not break. Shall we have a break room? Okay. So the first group, that is Myanmar group, may discuss generalist and clinical. The other group, that is Thai group, will discuss strength based and ACT model. Just go through it. Just pinpoint what are the important points about these four categories of or four models of case management. Okay. The first group, that is Myanmar group, will discuss generalist and clinical. Thai group will discuss strength based and ACT model. We will have 10 minutes for discussion, and then we will come back and present it,
Okay.
so that we can clear our doubts.
Okay. Okay.
10 minutes. Okay, fine. Break. Chit, break into two, please.
Right.
Okay, welcome back.
Yes, Dr. Francis, may I mention a little bit?
Yes, please.
Yes, when we were discussion, one of our members hints about the CBTX or community-based treatment program. So I told them that the ACT and CBTX is different approach. ACT is meant that you provide the comfort services at home and community, whereas the community-based treatment program is an approach at the community that provide the services to all of the substance abuse, something like that. Yeah.
Oh,
Right.
okay. Yeah, right. See, therapy. Let's say therapy or techniques that we give. ACT is not a therapy. ACT is a model. ACT means the treatment is provided in the community using the resources. The team, the service providers, that is the team, doctors, counselors, case manager, goes into the community. Why it is called assertive community?
Yes.
Because the community is ready to accept and take care of the treatment. They are part or they involve the community leaders or the community resource involved in the treatment process. That is why it is called assertive community. CBT is quite different. That is a therapy. Actually, we need a lot of. So these two are different. Very good. Thank you. I think it is clear.
Right.
Yeah.
Perfect. Good.
Yeah. Okay, now let's discuss it and let's see what they speak. Myanmar group, can you please tell us what did you discuss?
Yes, Professor.
Yeah, please discuss.
Can you see the slide?
Yeah, we can see.
First, we would like to present the brokerage generalist model. Brokerage generalist model helps clients identify their needs and access the resources. And brokerage generalist model is a relatively limited relationship between the case manager and the client. So the case manager can provide services to a lot of people. It is useful in the early phase of the case management, and it is used to address the immediate problems of the client, and there is brief ongoing monitoring. So it is not suitable for long-term management of the client, and there is no advocacy in brokerage generalist model.
Okay. Okay, Doctor, you did. Okay, go ahead.
Strengths-based model. In strengths-based model, the strengths of the clients are focused, such as the recovery capital. Recovery capital.
Yeah, very good.
Strengths-based model is used in moving the clients from the institutionalized care to the community, and it also encourages the use of informal helping networks, such as maybe family, friends,
yes,
social groups, peer groups, etc.
Okay, very good. Okay, very good. Arthur, I just want to ask you one point. Is the strength-based model good for people who are having co-occurring disorders? I mean, mental health problems?
Because it is the it focuses
On
it
the strength.
encourages it because it encourages the use of informal helping groups and discourages the institutionalized the use of institutionalized care. I don't think it might be suitable for clients with co-occurring diseases who might need more specialized or form of care or institutionalized care.
Very good. Okay. So basically, in strength-based model, the strength of the client is very important. That is his recovery capital is very important. In the brokerage model, only connects the client. Done. Okay. Thank you. Let's start. Good. Okay. Let's see. Thai friends, can you please discuss?
Yes, let's gonna start with the ACT first because we think that we have to present about student rates, but okay. Okay.
Doesn't matter.
Okay, for ACT, actually we have to do this program in Bangkok also. Yes, we have CBTS and also we have ACT too. I just know here, but I can pair with my work. It is the same. Yes, because I work with the community of sex with man sex with man or MSM.
Okay.
You know, yes, that they are staying in the group and they are close group. It's very hard to reach them and come into them to help them in another problem because they are close group like I said. So that I know the organization to help them and send them to rehabilitation and treatment about the drug abuse because they almost of MSM in Thailand is use chemsex. About 80% used to use chemsex, so that they send them to me to treatment for about drug abuse and chemsex and about sexual therapy, so that we have the service that provide in the community because the community of gay is not the housings or not the area, but they are the community in the not unreal world.
Oh.
Yes. So that we have the popular people in the social media to help us to promote about the program, so that in the community we have the organization, we have the foundation about the HIV, about the harm reduction, and about the health service. Yes. So then we use the service of this to help them in their community. Yes, by like a HIV test, like provide the clean object to use in the injection, like syringe or something like that. Provide the alcohol, provide the HIV, hepatitis B, hepatitis C. Yes, to help them with the vaccines or treatment. And finally, we have the counselor that they are also MSM, so that we know each other, and they are so very close relation with each other. And if they cannot hold or treat, they can refer to me or refer to the health center to help them for more help. Yes, and then this is ACT in Bangkok. Yes.
Oh, very good. So you gave us an example of MSM.
Sorry.
You gave an example of MSM community. Okay, I understand. So, so this model, ACT model, you mean it fits them more? better model for MSM community?
Yes, sure, because the result of the treatment is they can quit to use drug about 70%. Yes,
Okay.
more yes, it higher more than in the normal program in my clinic. Yes, this is very successful.
Okay, very good. Also, thank you very much.
Thank
Let's
you.
clap. What about clinical model? Did you discuss? If not, I can tell. Don't worry. Clinical model. Just tell us.
Can I ask a question to the health department?
Yeah, please.
Can you hear me?
Yes. Yes.
Why the assertive community treatment model is suitable for MSM population in Thailand?
For ACT, right?
Yes. Why is it good for the MSM community in Thailand?
Because in Thailand society, we are trying to reach the population in MSM for a long time before, but they cannot reach them because they are close community. They are just talking or connection with each other only in them social in them society. So that it's very hard to know how to them move and how to know dynamic of them. So that so now the chemsec is very popular in them. It's not in Thailand only, it's around the world because I have the data that around the world, MSM is always used the drug for the sexual activity. So that when I know this statistic, I try to help them by my occupation. I'm a psychologist, so that I know an organization that they have the activity with the MSM group in Bangkok and in Thailand, so that I try to work with them. I try to go with activity with them, and I try to give a knowledge to them. And finally, I have the popular person in the social media that gay or MSM like and follow them, so that I use them to be the platform to give information or give an knowledge about the chemsex to them. So that is very effective to promote the program and this program, and I can go to reach them and the final. Yes. So that I think I don't know for ACT before. Yes, to be honest, I don't know the ACT before, but when I listen to the professor and I read this again and I talk with my friend in this class, they are say that yes, they are the same and they can apply to each other.
Oh,
Thank you.
good.
Thank you. Professor Francis, I understand that the most striking feature of assertive community treatment is that the case manager and clients are closer than other models.
Exactly. The case manager has a lot of work to do.
Yeah, and also he is a lot closer to the client.
Yes. He goes to the community. Contact them, talk to them.
Yeah.
And he identifies their needs. He coordinates all resources. Very important.
That's why it has been, the assertive community treatment model has been successful in the addressing the drug problems of MSM.
Yeah. Yes, definitely. Because MSM community may not come to the mainstream of the society. They may be reluctant to come outside. So it is nice to go to them, and they are a community as such. They are very strong also. That is assertive. They are very strong community, but you need to go to them and help them. So maybe useful.
I think
Yeah.
we might need some MSM staffs in our team in order to go and contact with them. I think.
Yeah. You need a lot of professional skills. Otherwise, you may have difficulties as a case manager.
Thank you, Professor.
Thank you. What about the last one, clinical one? Just tell us what you understand.
About the clinical and rehabilitation model. I think that is the way to treat them by the medicines or rehabilitation in the center of rehabilitation.
Yeah.
And we also have the rehabilitation center in Bangkok also.
Yeah. Yes.
And I'm gonna say that every treatment and every service in Bangkok about drug treatment is always free.
Yeah.
For everyone, like for Thai, for migrant or foreigner, everything is always free for them. It include to HIV test, it include to psychological test, and lung X-ray.
Yeah.
Yes. All they are free. It's also PrEP. Yes, you know,
Yes.
the pre-exposure prophylaxis drug. Yes. It's also free too in Bangkok, so that it's very easy to treat them and give the service to them in every community, every group. Yes.
Yeah, you are right. It's rather an institutionalized model. Its approach is clinical, and it's one of the most widely used models in the world because we provide treatment in a facility and the whole team takes care of them. That's very important. Okay, very good. Let's clap for us.
Thank you.
Yeah, let's clap for us. Okay, finally, I understand some of you are already packing up. Maybe it is time to go. Yeah, but let me just discuss the final module and then we will close the session for today. Final module, just give me 5 minutes, that's all. Okay. Okay, the final module, that's steps of case management. There is nothing for me to discuss as such, no lecturing. This is a session we are discussing and we are having a presentation by the participants, trainees. So there are 6 steps: assessing, setting and prioritizing goals, developing a referral database, preparing the client for referral, following up on referrals, maintaining referral sources. We will have group discussion and presentation. So, shall we do it as a homework? You go home, each one of you get prepared.
Yes, sure.
Yeah. So then the Thai team, please take assessing, setting and prioritizing goals, developing a referral database. The Myanmar group will discuss preparing the client for referral, following up on referrals, maintaining referral sources. Both of you, both groups, please check your participant manual. Resource page 1, 2, 3, 4, 5. Manual. Resource page 41, 42, 43, 44, 45, 46. All the information study materials are there. Page number 173 onwards. Page number 173 onwards. Both group, please check your reading materials. Prepare. Maybe you do a PowerPoint presentation. So please, this night, as a homework, the Thai friends may discuss among yourself and just prepare a PowerPoint presentation. And the Myanmar group also follow the same. Tomorrow when we come in the morning, we will spend 10 minutes for preparation. Maybe you can discuss as a team and then you prepare the presentation and then you present the PowerPoint presentation with all colorful sketches or whatever it may be. With that, we finish this curriculum 6. Any doubts? Is it clear how to prepare and how to tomorrow?
Yes.
And shall we stop for today? Can we stop?
Yes,
Sure.
thank you so much.
Yeah, thank you very much. We will meet tomorrow morning just for half an hour. Thank you.
Thank you.
Thank you. Thank you. Goodbye. Take care.
Thank you, Dr.
Bye-bye.
Francis. See you tomorrow.
Bye-bye.
Just half an hour tomorrow. Good. 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 Okay.
For participants, 1 or 2 minutes, please. And Myanmar, everything is clear. Are there any complaints from Myanmar? Complaint today? Or I think you are clear for today because today we work hard all days since morning until at the end of the day. This is new for you about the case manager in Myanmar and ACT, right? For Thai people, please prepare. Yeah, for Thai people, please prepare PowerPoint for tomorrow,
Okay.
right? Okay. And who will prepare the PowerPoint to presentation for tomorrow?
We separate each other as a group teacher, so that tomorrow is the group tree. The group tree will prepare and take and presentation tomorrow.
Good. Okay. Any comment or any question for today since morning until at the end of the day? Today you are good participate, nah? I would like to clap for you, nah, because you good participate.
I believe that today is very, very important to us because the knowledge of today can apply to our work in the future. And I think it can develop our work too much. Yes, I like to thank you for today.
All right. Regularly you do it already in your institution, right? So it is not new for you. Yeah. It is good. Yeah. Okay. If you didn't have any mention or comments, see you tomorrow, and please check post test of the previous course 1, course 2, course 3, course 4, course 5, because we will evaluate